Hi guys, Doc Rolly po. Ibabahagi ko po naman ngayon ang lecture na ginawa ng ating former OIC Secretary of Health na si Dr. Rosario Vergiere na ginanap sa 18th Dean Jose and Esteban Memorial Lecture sa College of Medicine ng De La Salle Medical and Health Sciences Institute, ang alma mater ni USec Vergiere, Willie Ong, and alma mater din po ng yours truly.
Maibigay ang karampatang lunas, marami sa aking mga naging pasyente ay walang pantustos. These experiences further ignited an inner calling towards public service, which only intensified as I continued my practice. I then decided to pursue a master's degree in public health at the University of the Philippines. Not only was this a welcome break from work, but more importantly, it was an opportunity to hone my knowledge. I was reassigned to the ambulance service of Marikina. In line with my commitment to make a positive impact, I transformed this role and improved the city's emergency services that would bring medical services closer to our Filipino people. With the completion of my master's degree, my horizons also expanded, thereby unlocking more opportunities for me. Got into policy, got into planning, and the rest was history. Palipat-lipat, pero sa bawat puntahan na posisyon, may nababaon na learnings. Community and the people inspired me to create policies with the intent to move the needle in improving health and overall lives of our kababayans. Sector reforms. Not only can I pass what I have learned from my own experiences, but I too could continue to learn from my students. And now, Undersecretary, to accept. Bukod sa mga gampanin na ako bilang OIC Undersecretary ng Health Regulations Team noon, nag-aalinlangan ako dahil pakiramdam ko hindi naman sapat ang aking kaalaman upang maging tinig ng kagawaran. However, I was inspired to take on this task partly because I remembered how my father, who was my biggest fan actually, would proudly post my accomplishments on social media whenever I appeared on television, pre-pandemic. So tatawagan na niya yung mga kabarkada niya sa simbahan, tatawagan niya yung mga kamag-anak namin, ipopost niya sa Facebook, kahit na mga maliliit lang na mga picture ko. But unfortunately, of course, he passed away months prior to my appointment. But I hope that my decision to meet the public and represent the Department of Health and represent, of course, the whole government every 4 p.m. during that time, despite my apprehensions, made him immensely proud. For the Public Health Services team. Isang malaking hamon itong inatas sa atin, lalo na tayo ay nasa kasagsagan ng pandemya noon. I felt that I really had to step up and to address the uncertain challenges I took it upon and keep abreast of the latest developments. Nevertheless, I also done technical and science. What the Filipino people really needed at that time was reassurance. Everything away my weekends. My only reprieve were the nightly dinners with my family that I made sure not to miss. So kung dati po lahat work from home, dati po lahat ay nasa bahay lang dahil may lockdown, kami po ay pumapasok noon. At kami po ay kasama at pumupunta pa rin sa mga iba't ibang opisina ng gobyerno para makipag-meeting. So, yun pong oras para sa pamilya, parang nawala na lahat. But as I've seen the DOH anticipating who our next leader was, I was honored to be appointed as the officer in charge and the concurrent Undersecretary of Health. Because this was not a responsibility that I had anticipated, I again felt that there was much for me to learn, while also considering variables that I had no control over, such as the length of time that I would temporarily be leading the department. Kaya naman, pinagnilayan kung mabuti kung aling mga hakbang ang maari kong masimulan for when the next secretary eventually gets appointed. I look to the figures in my life. One of them, of course, was Dr. Esteban, who I remember to be a positive yet persevering individual. And so I emulated this kind of outlook in my work as the OIC Secretary of Health. I came into terms with the fact that there will always be things that I simply had to learn while also undertaking an enormous task. I resolved to persevere and pour my hard work into leading the health sector while also essentially learning from the job. I was learning not just from my peers and those who came before, but also from the stakeholders and the youth. Engaging with a variety of people gave me deeper insight on how we can truly realize health for all. Among the various learnings we gained over the course of the pandemic, of course, included how to limit and manage COVID-19. Philippine healthcare system was. Although we have always been working towards strengthening our healthcare system, the pandemic tangibly illustrated this fragility even for people not involved with the health sector. Our resources could not keep up with the unprecedented demand for health services. During the start, we only had one quarantine facility in Clark. Now we have 72,696 beds across the different areas of the country for our temporary treatment and monitoring facilities. So that goes to show how a multi-sectoral effort will give us this kind of outcomes. Hindi po kaya ng gobyerno lang, kaya kailangan po lahat ng tulong during this time. Delivery of necessary health services that each Filipino would need while averting out-of-pocket spending that could drive people into poverty. This calls for the shifting of our priorities from developing specialized care that is delivered in a fragmented manner towards a more strengthened preventive and primary care. Accessing specialty care then would be brought closer to patients who need them the most. Ang ating mga mahihirap na kababayan. Poverty is a major barrier to accessing proper health care, leading to poor nutrition and exposure to many risk factors. Thus, poverty causes illness. Tulad ng pagkain at iba pang mga pang-araw-araw na gastusin. Kung pababayaan ang kalusugan upang maiwasan ang gastusin, kalaunan, mauwi ito sa paglala ng karamdaman na kakailanganin ng mas mahal na gamutan. This vicious cycle of poverty and ill health illustrate that what I personally observed while working in the grounds or on the ground in the city of Marikina. With bias towards marginalized sectors, including the poor, persons deprived of liberty, homeless, indigenous people, and the like. We carry this out by targeting the environments where people navigate their day-to-day lives, like in schools and workplaces, so that healthy behaviors could be enabled. Department is no longer on my metaphorical plate. Our work does not stop. The complete implementation of UHC is still underway, and many of the health programs necessary to fulfill this remain to be my journey, likewise my constant sources of inspiration. These recognitions motivate me to continue learning and honing my skills so that I could hopefully inspire others to also persevere in which avenue of profession they may be. As we conclude this memorial lecture, allow me to impart to all of you 5 nuggets you can bring along on your respective journeys. First, be humble enough to accept one's limitations. This is something that I have learned when I was tasked to be the Department of Health spokesperson, a role that you would not typically assign to a doctor like me. I accepted this knowing that I have very little experience for the role. I had to come to terms with my limitations in terms of my skills and seek the abilities of people around you. This applies to everyone we work with, not just our peers. We should recognize that we cannot adequately fulfill our duties without the people who support us, including our staff. Most importantly, of course, is to respect the people that we serve. For those of us with considerable authority in our work, it is sometimes easy to forget that we are working for the betterment of people. Kaya naman, lagi po nating aalalahanin na ang mga taong atin pong sinumpuang paglingkuran ay atin din pong irerespeto. Third, do not be afraid to redefine yourself. The pandemic has constantly redefined and transformed what normal is for many people. If there is anything that we individuals should learn from the recent pandemic, it must be how to welcome uncertainties and teach ourselves to adapt. I apply this in my life whenever I find myself faced with new challenges that I am apprehensive to take. Encourage transformation for everyone. Change must not be confined within oneself only. It must emanate so that others around you could also be transformed. This change does not necessarily have to mean turning a full 180 degrees and overhauling someone's character. It can mean improving the status quo and building up on the skills and knowledge that people already have. One example is encouraging and educating Filipinos to observe healthy behaviors. This is one where if many people and families adopted, ripples of change would eventually lead to a community where few will get sick. Put your decisions in values you hold dear and remain steadfast in your principles. This may be easier said than done. Often, we don't immediately identify situations where our beliefs and value systems are being challenged. However, when we equip ourselves with the tools such as up-to-date information and a strong moral compass shaped by our communities, we can navigate decision-making with more ease. I was frequently faced with this, particularly during the early days of the pandemic. Our knowledge on COVID-19 then was limited, yet there were urgent decisions to be made. During these times, I would recommend actions that uphold positive lenses so that perseverance despite trials does not feel like suffering. Instead, they feel like opportunities through which we can both grow ourselves and enrich the lives of others. My journey since graduating from our esteemed institution has been a winding path full of unexpected twists and turns. It has also been steep, where I had to continue onwards despite my personal doubts and apprehensions. Through it all, I carried with me the guidance that mentors like Dr. Esteban has imparted, to look at the patient as a whole and not simply as some of its anatomic parts. This will enable us to find the good within each and every person and each and every system, so that we can be guided to take the next best step. This means that when faced with concerns or issues, we must listen attentively, address empathetically, and consider factors beyond what was presented to us so that we can truly address issues at their root. Muli, maraming salamat, De La Salle Medical and Health Sciences Institute community. Pinagmamalaki ko po, I am very proud na ako po ay hinubog sa loob ng mga gusaling ito to be among the catalyst of the spiritual, social, and economic transformation of our country. I will continue to imbibe the values that La Salle taught us: zeal for service, community of mission, and spirit of faith. In my work, not just in the department, but as a public servant in general, towards the achievement of universal healthcare, tungo po sa isang healthy Pilipinas. Maraming salamat po.
Thank you, Doc. At this point, let me open the floor for a few questions. Do you have questions? Batch 2024. Hi, Doctor.
Otherwise yung nangyari po. And we didn't expect it actually, because during the time of the pandemic, we were able to implement the different concepts that were included into dun sa law. Nakapag-create tayo ng networks, na-establish po natin yung iba't ibang mga facilities na hindi naman natin magagawa in just 1 or 2 years kung atin pong tinahak yung regular timelines natin for universal healthcare. So during the time of the pandemic, we were able to somehow start or continue on with the implementation of universal healthcare. Ang pinaka top of the list po kasi kapag UHC ang pinag-usapan, we are now talking about healthcare provider networks, primary care provider networks. We are now talking of benefit packages coming from PhilHealth. We are now talking of navigation, or navigating our patients through the entire process of the health sector or the health system. So yun po lahat nakita natin during the time of the pandemic. Though it's not institutionalized yet, but now we are getting bits and pieces of those good practices and has put it into this
public health. Are our universities, hospitals, and training programs prepared for this? Kung halimbawa magkaroon ng shift during the implementation of the universal health law.
Ocampo.
Thank you, Dr. Ocampo. Hanggang ngayon, napakahirap po pa rin magtanong. Si Dr. Ocampo is a very good friend. So, but anyway, yes, again, no, there's this misconception kasi that when we talk about public health, it's totally detached from clinical practice when it should not be. No? So, halimbawa, tayo ay nasa ospital. Hindi naman ho dapat purely clinical, di ba? Because in the hospitals, we still have our surveillance. We still have our public health units kung saan pinapatupad po yung mga programa for public health, katulad ng pagbabakuna, pagbibigay ng family planning do sa mga nanganganak, so on and so forth. So let us not try to detach public health from the clinical side. My point being, when I said that dapat mas may geared towards public health ang mga kabataan ngayon, that they have more of these concepts in mind, that even when they become clinicians or become specialists like a cardiologist or surgeon like you, dapat meron silang perspective of public health. They know the determinants of health, na hindi lamang yung pasyente ang tinitignan natin kapag ang tao ay may sakit, kailangan tignan din natin yung ibang aspeto ng kanyang buhay, so on and so forth. So, that's one. The second would be, ano yung track or ano ba yung, how do you say this, direction, because magkakaroon na tayo ng universal healthcare na pagpapatupad, ano na dapat ang track ng mga kabataan? You still go through, no? This, kung magki-clinician kayo, kung magpa-public health kayo, but what is stated in the law would be that we will accredit primary care providers. That's one. It's very clinicians naman, no, sa ospital. Siyempre, hindi lang naman ho yung public health side ang ating nire-reform o yung primary care. We're also reforming the entirety of the system. So ngayon, instead of you working in a individual hospital, halimbawa ngayon dito sa Lasal, you now will work within a network that patients can be easily navigated from one facility to another within that network. Ang pinakamalaking bago dyan would be the financing. Kasi yung financing, a special health fund will be established kung saan lahat ng mga ipupool nyo yung mga pondo nyo, no, within that network through that special health fund. And that's where you get to have your revolving expenses or resources. So
that we could act as public servant. All right? Any other sharings? Yes, doctor. Yeah, we have also here. Next to you would be Dr. Ramos.
Against tuberculosis because parang I don't know, since I was, we were studying in medicine, TB was already a problem.
Yes.
And in here now, 30 years later, I think the incidence of PTB is getting higher compared before.
Yeah.
And I am a member of the TB DOTS program in my place, and then I was surprised during the pandemic. I thought TB would be, would slow down because of, everybody would wearing masks.
katabi na natin kanina, pwede na nagkwentuhan na lang kami, di ba? Gusto niya yung may mga audience kami na. Joke lang po, I think this is a very good question, and I think the students will learn, from this kind of discussions. So unang-una po, yes, we agree with Dr. Jiri, napakalaking problema po ng TB. Ang Pilipinas po ngayon ay nagra-rank as part of the top 7 countries all over the world, which contributes to 90% of the burden of TB all over the world. So that's how heavy that is, na talagang meron tayong ganong brand internationally. So ang TB po ngayon, sad to say, and as what Dr. Jiri has mentioned, talagang tumaas siya, especially during the time of the pandemic when access was really zero. When patients who had symptoms didn't have any, the TB cases should have decreased because of this wearing of the mask. Pero pag uwi po ba natin sa bahay, we don't wear a mask. And we know that the number one propagator of this transmission would be from family to family, family member to family member.
Yes.
Diba? So, yun po yung ating, sitwasyon ngayon sa TB. So sabi ko, kailangan systemic tinitignan natin. Kailangan tignan nyo yung kabuuan ng pagkatao ng tao. Kailangan tignan natin from detection
Realize that tuberculosis is a problem. Yes.
Dr. Ramos.
Dr. Ramos.
Magandang umaga po. Papasalamat kami na nakapunta po kayo dito sa dati yung pinagtapusan. Ang tanong ko po, one of the biggest, if not the biggest project here at De La Salle Medical and Health Sciences Institute is the redevelopment of the University Medical Center. We're now in the process of designing a 500-bed facility, 400 paying and 100 teaching. In the allotment of spaces, now in the context of universal healthcare, is there anything that we should be putting there to address the requirements of UHC? Do we need to put up more facilities for outpatient clinics, better communication with the local government units? Because we know that there will be a change in the composition of the patients coming here as a tertiary medical center. While we want to position ourselves as a cardiac and cancer care center, we also want, of course, to be compliant with and help address the health situation by being supportive of the universal health care. Meron po bang design na po pwede kaming ipalit? We're still in the planning stage, ma'am.
Thank you, Mr. President. Actually, not really sa design, but on the composition of the number of beds. So healthcare, nandun na ho siya sa mga paunang mga batas na naipasa natin, kung saan minamandato po ang isang pribadong ospital na kailangan at least 10% of your beds should be allocated for service patients. So yun po yung tinitignan. Kaya during the time of the pandemic, hinanap po namin lahat itong mga kamang minamandato ng batas dahil marami po sa ating private institutions hindi po na-check, so wala ho silang mga ganyang kalaking allocation. So nung time ng pandemic na kailangan pasok na mga service patients sa private, wala kaming makuha na support nung una sa private. But you know, after a while compliance. To the anonymous sender of this question.
Namin isa tayong participant.
Yeah, ang dami, 'di ba? So napaka-political naman, hindi lang yung trabaho namin, pati nga kayo siguro, you face this kind of politics in your everyday lives. Even by just treating patients, there would always be politics there. And that is our reality. Lalong-lalo na kami, especially as an official of government, an official of the department. So ang gusto niya, mag-cite ako ng isang instance. So I'd like to tell all of you about what happened during the time of the pandemic. So we had an interagency task force. Alam niyo po yung IATF, no? So yung IATF was comprised of, actually all of the cabinet officials were there. And most of the cabinet officials during the time,
There was an election upcoming. Sabi namin, Rosete, mag-run ka as senator, sigurado number 1 ka.
Sure. Yeah.
Diba? Pero di ba, parang Rosete, mas mabagsik ba kaysa sa IATF yung mga questions sa'yo?
Yung retention as the voice of the Philippine pandemic. Woohoo! Every time, ito po, every time alas 4, lagi ko sinasabi sa tatay ko. Right, so I feel you have questions, conundrum, you want affirmations? Okay. You ba, isang trivia. Meron isang question, isang trivia, doktora. I've been emceeing since 2008. And this is the most active batch 20, actually clerks, na talagang tanong ng tanong. This is, yeah, true. Since 2008. The most active batch.
Good morning po. I'm Clinical Clerk Shekena Cavite from batch 2024 po. Just want to say po na thank you po for a very insightful talk po. Yung question ko po is regarding po sa Doctors to the Barrio po na program. So, yung una po is, what can you say po about po sa view na yung program po for Doctors to the Barrio ay just band-aid solution po sa healthcare po natin, sa healthcare system po natin. And also, since before po I considered being a doctor sa the barrio po in the future, before, since marami din po kasing cases po na pinapatay po na doctors, na doctors
Really?
to the barrio. What can you do po sa DOH to protect the doctors po na nasa program? Thank you po.
To become a doctors to the barrio or doctor to the barrio, hindi mo muna iset aside. No?
Yes.
Think about it more. Yes, I agree with you that really, nung binuo po ang Doctors to the Barrios program, it was really supposed to be a band-aid solution. Because during that time, talagang nakikita na natin and felt na yung kakulangan sa mga doktor dun po sa mga malalayong lugar. Kaya it was created. And unfortunately, the main objective of Doctors to Barrios was to fill in the gap, no, during that time. But the main objective was to capacitate local governments that after 2 years of that doctor being assigned in their area, they get to be absorbed as regular plantilla ng local government. Yun yung usapan. Kaya laging kapag nagde-deploy tayo ng doctors to the barrio sa mga areas, meron tayong mga memorandum of agreement with local government. And nandun yung sinasabi natin na to si Mr. or si Miss Anonymous is very
So this is when some international agencies are starting to pull out their funds for different projects, especially in terms of research. So I would like to ask lang po, how are the capacities of our local health units in terms of the Mandanas ruling? Parang are they still doing okay with the idea, or does DOH have solutions that will help mitigate it? Thank you.
So, yeah, Mandanas Garcia ruling, it became a law. So, ang nangyari, mas dumami na ngayon ang apparently, bibigay sa local governments compared to the national government offers. So, having said that, ang utos sa amin, yung law that was in 2021, draft your devolution transition plan already. Kasi sinasabi nila, sabi ng DBM sa amin, 2023, pag pinatupad yan, dapat papatupad na rin natin yung mga approved devolution transition plan. So what are the devolution plans? Ang devolution transition plan ng bawat i-delineate mo ngayon, no? What should be the mandate of the national government compared to the mandate of local governments? Ano dapat yung pinagkakagastusan ng national? Ano dapat yung pinagkakagastusan ng local government? So in terms of health, ang pinagkakagastusan dapat ng national government as based on the UHC law are population-based services.
And here's the ultimate question. Paano ka ba, Doktora, namin mako-convince na tumakbo sa Congress, sa Senate, to represent the healthcare?
Alam niyo, not unless you're part of the party list, you represent your district, no? So dapat, ang tatakbuhin natin ay Senado. So we leave it to God, no? Kung ano po yung saan tayo pupunta. And of course, we always pray for that wisdom where we can better serve our people. Pagka sa susunod na eleksyon, barangay captain. Di ba? Parang kapag ka magsaserve ka, parang mas feel mo yung nararamdaman mo, no? Yung sa ground, nararamdaman mo yung mga kasalamuha mo, nakikita mo yung epekto ng binibigay mong tulong sa mga tao. But anyway, kung nasaan man po tayo, I'm always here to help and support and will always champion for the healthcare sector.
Alright! And show some love to the cerebral and the voice of the Philippine pandemic, Doctora Maria Rosario Vergeire. Maraming salamat po. Such a charmer, very intelligent. Alright, let's proceed now to the awarding of Institute Lutheran Life. Presents the certificate of appreciation to the Dr. Maria Rosario Vergiere, MD, MPH, CESO 2. For her invaluable contribution as a memorial lecturer to the topic, A Journey of a Sallian, Lessons from the Pandemic, Lessons from Life and Career, during the 18th Dean Jose Navarro Esteban MD Memorial Lecture, given this 13th day of September in the year of our Lord 2023 at the Dasmariñas City, College of Medicine, City of Dasmariñas City.
Thank you for watching, guys. See you in my next video.